It was confirmed by Minister of Health Dr. Frank Anthony on Friday during his COVID-19 briefing that among the 20,000 persons who have tested positive for the disease, children account for 1,567. The age range of the cases reported by the minister to date indicates that a majority of the children who were confirmed COVID-19 positive were between 10 to 14 years old.
In between the ages of, let's say, 1 month to 4 months, 4 years, we would have had about 287 children of that age, between that age group, being infected, 148 males and 139 females. And between the 5 to 9 year age group, we would have had 273 males and 251 females, which a total of 524 for that age category. And then between the ages of 10 to 14, we would have seen 342 males and 414 females, a total of 756.
Dr. Anthony noted that while most of the children experienced a mild form of the disease, healthcare providers have stumbled upon a worrying new trend, which has landed a number of them in the intensive care unit at the Lillian-Dahl Hospital.
And right now, in our hospitals, we have 4 children who have been severely affected by COVID. And so we are monitoring them, and hopefully the prognosis would be good because the medical team is really working to ensure that they can provide the best care for these children.
The minister emphasized the need for parents and guardians to ensure that children follow the COVID-19 precautionary measures, since none of the vaccines being used in the country's inoculation drive has been approved for children.
To make sure that they are protected, they wear masks when it's necessary if they're going out, because the virus, as we can see, can affect children. And I don't think a lot of people have paid attention to that.
Prior to the commencement of Guyana's vaccination drive, Dr. Anthony had said the jabs would only be administered to adults since they were at a higher risk of experiencing severe forms of COVID-19. At the time, children were considered low risk since local evidence showed that children who tested positive were either asymptomatic or only experienced mild symptoms and quickly recovered due to a stronger immune response to the disease. Health authorities have not identified the cause of the change in the way the disease is now operating and affecting children. However, across other parts of the world, increases in child COVID-19 cases have been attributed to new variants of the virus. Children are said to be at a higher risk of infection from the Delta variant, first identified in India, and the Alpha variant, which originated in the United Kingdom. The Delta variant, which is described as the most transmissible of all the variants so far, and which is said to attack young people and children, has now spread to 85 countries. It has become the dominant strain in the United Kingdom, currently accounting for more than a third of the new cases. It is still unclear whether there are any other variants of the SARS-CoV-2 virus circulating in Ghana, since patient samples have not been sent abroad for testing since January of this year. Meanwhile, the good news is that the number of persons accessing the COVID-19 vaccines locally is on a steady rise. As of Thursday, 234,255 persons had been administered first doses, while 112,371 had been fully immunized. Temika Rodney reporting for the HGP Nightly News.